Hi everyone, my name is Alfredo and I'm doing a presentation on Avoidant Personality Disorder for my Psychology 101 class. I hope you enjoy. So for our agenda, we're going to go over what it is, some of the symptoms, possible causes and influences, proper diagnosis, and common misconceptions, as well as therapies for treatment and effectiveness. So to start, what is Avoidant Personality Disorder? So, by definition, I'm actually going to read my own. I have it on the bottom. Avoidant personality disorder, AvPD, is a mental health condition defined by intense social inhibition, profound feelings of inadequacy, and extreme sensitivity to criticism. Individuals with AvPD may yearn for relationships but often withdraw from social interactions due to a deep fear of rejection and being judged. This can lead to significant personal and professional difficulties, including chronic loneliness and isolation. So the symptoms and behavior patterns. So what does it look like? What does it look like when somebody's living with AVPD? So the symptoms go as shown: extreme social inhibition and shyness, persistent feelings of inadequacy and inferiority, strong avoidance of social or occupational activities that involve significant interpersonal contact, reluctance to engage in new activities or take personal risks due to fear of embarrassment, hypersensitivity to criticism or rejection, intense fear of being ridiculed or humiliated, difficulty in forming close relationships outside of a trusted few, self isolation despite a strong desire for social involvement, and that one is key. Self isolation despite a strong desire for social involvement, overemphasis on negative outcomes in social situations, and overall low self esteem and a perception of being socially inept or unappealing. So a lot of the risk and factors are, as I was reading and learning about this, it's a very multifaceted and complicated uh, group of causes that it's a combination of genetic, environmental, and psychological elements. Those being genetic predisposition, there is evidence that points to a hereditary link, where whether that is from your family, parents, grandparents, it can be passed down. Early life experiences. This can be emotional neglect, abuse in your early childhood, persistent criticism, and that increases vulnerability to developing AVPD. And they contribute to a strong fear of rejection and feelings of inadequacy. Your attachment style. These are patterns formed from childhood, such as anxious avoidment attachment. This often stems from inconsistent caregiving and can lead to deep seated avoidance of close relationships when you're an adult. Temperament and your personality traits. Individuals with naturally high levels of sensitivity or introversion might be more susceptible as these traits align with AVPD. It is one of the risks with AVPD is that it's compounded by a cycle of psychological factors, upbringing and environment, potential biological predispositions, but mostly avoiding social situations, which leads to isolation, and that reinforces the feelings all over again of inadequacy and the low self esteem. It kind of just builds on itself until it becomes a very severe case if not treated. So for diagnosis, the process that this will usually go with is meeting with a mental health professional, and this would include a clinical interview, examination of your personal history, observations of your current behavior, and clinicians use diagnostic criteria from established sources like the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, which lists patterns such as persistent avoidance of social interaction, fear of criticism or rejection, and feelings of inadequacy. Additionally, self reported questionnaires or structured clinical interviews may be utilized to assess the severity and presence of your symptoms. So, let's start with moderate AVPD. Individuals with moderate forms of AVPD may experience significant discomfort in social settings but can still engage in limited relationships and professional activities with notable effort. Their fear of rejection is substantial. They may manage to navigate certain environments, albeit with persistent anxiety. These are people who suffer with AVPD but can still get up, go to work, talk to their families, talk to their brother and sister, maybe even maintain a healthy relationship. Just still dealing with those struggles, those thoughts, and persistent anxiety. Now, compared to severe AVPD, these are individuals who have profound social withdrawal, making it extremely difficult to engage in any form of social or professional activity. This avoidance of behaviors becomes pervasive, affecting daily functioning to the point of total isolation, and can lead to extreme loneliness and heightened vulnerability to additional mental health issues such as depression or severe anxiety disorders. The distinction often hinges on the extent of social and occupational impairment, with severe cases exhibiting near total social avoidance and significant life disruption compared to more manageable, albeit challenging, interactions in moderate cases. Somebody with severe AVPD would not be able to get up and go to work. Maybe even things as simple as going to the grocery store could be extremely challenging for them because they are so afraid of being judged, being embarrassed, maybe even messing up, and the thought of everybody judging them, criticizing them, impairs them from even attempting it. Some of the common misconceptions are confusing it with social anxiety disorder. They have a lot of similarities, but social anxiety disorder primarily relates to specific social fears, while AVPD is a more broader and more ingrained condition that impacts overall personality. A lot of people will confuse it with shyness, but shyness is not a deeply rooted personality disorder. It's just something that people can be. It's a personality trait. Um, Overgeneralizing introversion. While people with AVPD may seem introverted, not all introverts have AVPD. So that in itself contradicts itself. But the disorder involves extreme levels of avoidance and self criticism that surpass normal introverted behavior. A belief that AVPD is just laziness or apathy. In reality, individuals with AVPD struggle with debilitating self doubt and anxiety that prevent them from participating in activities or even taking risks. It's not really that they're lazy, it's just that they don't feel like they can. An assumption of disinterest. This one most commonly with friends, partners, family, where people believe that they're just disinterested and not wanting to be involved, when in reality, they want to have these meaningful connections, but they avoid them due to that intense fear of rejection or criticism. And of course, thinking it's just a phase. I think everybody has heard this. Assuming that individuals will grow out of this, when in reality, it's a complex and long term disorder that typically requires treatment and therapy for significant improvement. When it is ignored and generalized as just a phase, or telling somebody that they will grow out of it, it can always lead to a more severe case because of the lack of treatment. So, getting into treatment and management. We'll start with psychotherapy, the most common being CBT or cognitive behavioral therapy. This is a treatment that helps individuals recognize and change their patterns of negative thinking and avoidance behaviors. This focuses on building social skills and confidence. There's also schema therapy, which, as a therapy, digs deeper into underlying patterns formed in early life that contribute to AVPD. It helps patients understand how their early childhood experiences, how they were raised, led them to believe these deep seated beliefs, and how it developed into AVPD. And then we have psychodynamic therapy, which is an approach that helps individuals how they dealt with certain experiences and how those certain experiences contributed to their current fear of rejection and avoidance. Of course, medications, that being antidepressants and anxiolytics, antidepressants being selective serotonin reuptake inhibitors, and they can alleviate symptoms of anxiety and depression, which often occur with AVPD. Sometimes it can be other antidepressants that don't fall under the SSRIs category, and anxiolytics, which are medications that target anxiety, and they may be prescribed in some cases, though they are usually a short-term option alongside therapy, while antidepressants are more of a long-term medication that can be taken as you go on with your life. Sometimes they may be permanent. And of course, other forms of therapy, there's group therapy, social skill training, and self-help support networks. Group therapy being a structured supportive environment that can gradually reduce social fears and promote interpersonal skills under that safety net of having a uh, mental health personnel there to guide, and also dealing with other people where you're not forced to interact, but being structured in a way where you feel safe. social skills training. This is a more focused, and it helps develop with effective communication and socialization techniques. This can be focused towards professional social skills or interpersonal social skills with your family, with your relationships, with your friends. And then self-help and support networks. Support groups are mainly focused for people who all suffer of the same disorder, so they can share experiences, gain mutual encouragement to get better, and just have a space so that they don't feel isolated. And self-care practices like establishing regular routines, and I think this is the most important bit, just practicing that mindfulness, stress management, self-compassion techniques like words of affirmation, having that routine every day. So even on your worst days, you can still wake up and know that what you have to do, and after you've completed what you have to do, you gain the sense of confidence, you gain the sense of um, accomplishment that you have gotten through the day. And I think that is vital and one of the most important things to getting better. And of course, because it is a personality disorder, ongoing therapy is often necessary for lasting improvements. Treatment may evolve over time to address changing needs as individuals develop greater social comfort and self confidence. Combining these treatment options under the guidance of a skilled mental health professional can lead to significant improvement in managing AvPD. With everything, it is not just one and done. You have to continue with the treatment. You have to change with it as you gain more skills. Maybe you started not being able to go outside of the house and now you have a job, but there's still more to work on so that you can become a better person for yourself, for your family, for your work, and of course, and most importantly, for yourself. These are my resources. I recommend anybody who is interested in learning more about them, please follow the links, look into the institutions. Very reliable, very credible, and great sources of knowledge. That's all I have for you guys. Thank you so much. Thank you to my professor once again. Avoidance Personality Disorder. I hope you learned something. I hope you took something with you. And if you're suffering through this, please don't be afraid to seek help. It can get better. Thank you so much for your time. Bye bye.